Yeah, good evening to all my subscribers. Welcome to my YouTube channel. Thanks for subscribing. Those who have not subscribed yet, subscribe, put on a notification, and may continue to enjoy as we learn. Yeah, today we're going to talk about ulcers, peptic syndrome, gastric ulcer or peptic ulcer disease. Yeah. Many clinicians, they abbreviate it as PUD, peptic ulcer disease, but some call it as peptic syndrome. It has many names, but collectively it remains the same. The cause remains the same. What causes ulcers? Ulcers are just wounds or abrasions. They can be on the skin, what we call skin ulcers. They can be on the body, on the ulcers. They can be on the back. But these ones, we are talking about the ulcers in the stomach, the mucosal lining of the stomach. Why are we having dyspepsia or dyspeptic or peptic? It means that it is involving peptic acid or gastric acid. So, what happens? What does the acid do? What happens is that this acid brings this condition, these ulcers. One, we have to look at the acid, which is separated by the parietal cells in the mucosal lining of the stomach. So, the function of this acid is to provide an acidic medium in your stomach, such that the enzymes in the stomach may work on your food. And most probably the proteases, which break down the peptides, proteins, and the more which work in this pH. So, being so important, this acid has to be regulated. It has volumes it doesn't have to exceed, and it's not there all the time. It is separated when the food is there or when it is needed. Now, so what are the common causes of this disease? What are the common causes of this acid? Okay, yeah. Now, ulcers develop, or these wounds develop in your stomach as a result of the acid corroding the walls. So what brings this acid to corrode these walls and that you develop these wounds or ulcers in your stomach? One cause is what we call Helicobacter pylori bacteria. It is a bacteria which is found mainly in your pylorus, that is part of the stomach, just below as you're heading to the duodenum, that tract. So this bacteria can affect and stimulate these cells to release acid, which acid is going to corrode your mucosal lining. Secondly, we have what we call non-steroidal anti-inflammatory drugs or anti-inflammatory drugs. An example is aspirin, diclofenac. These also affect your acid separating cells, and they stimulate them so that produce these acids that are going to corrode your wall and develop these ulcers. Another cause, and the most cause in youth and those drug abusers, is chewing when you are not swallowing. Once you put something in the mouth and you start chewing, the stomach is stimulated to prepare for this food to come, such that it is broken down. So you are chewing, let's say, a bubble gum, you are chewing mirror for those drug abusers, but you are not swallowing. So the stomach will keep on separating the acid, but the acid will not have the food to work on. So the work of this acid is to provide the pH for the enzymes to work, and then to kill the germs which come with the food. So once they don't get the food, it's going to go on your walls of the stomach and corrode them. There are other causes of this acid disorder, like histamines. Histamine can also stimulate release of this acid by stimulating the H2 receptors on your After seeing those causes, we are going to look at what we call exacerbating factors. What are the factors which increase the risk of developing this disease, or which worsen the disease? Exacerbating factor, the factors that worsen the disease once you have the disease. One factor is taking acidic foods, taking pineapple, taking orange, taking the sodas. They are going to worsen your condition. Secondly, we have foods which also worsen the condition. Now, once you eat these foods, they are going to worsen the condition, such as toke, sweet potato. But we eat these foods, so it means you have to treat the disease and then you eat these foods. So another factor is we have seen there is alcohol. Alcohol also is a factor which can worsen this condition once you have it. So we have seen acidic foods, we have seen certain food types like matoke, sweet potatoes. You take them, you feel agitated, and there is alcohol and many other things. So what are the signs and symptoms that you may consider and say that I have this disease? One and most commonest sign is epigastric pain. You feel pain here. You feel pain around here in the epigastrium. Two, you can have upper abdominal pain. You can have nausea and vomiting. All these could be associated to this disease. In these severe cases, you can have blood, you can vomit blood in the severe cases. Even in stool, you can have blood stool in the severe cases. You can be seeing blood in the stool. So after seeing all those signs, there is also a common sign, having a burning sensation throughout your chest. You feel it starts here, you feel like the heart is burning. Most people call it heartburn. You have a burning sensation in the chest, it goes up like this. So that one, in medical, we call it gastroesophageal reflux disease. And it's also related to acid reflux. When you accumulate acid in your stomach, and it tends to move upwards, so it brings that irritation and burning sensation along the esophageal tract. So you'll be feeling that sensation. So other causes of that one would be after lying flat after eating food, immediately after eating food, and lie flat, the acid will also pop up and you get these sensations. So now you may wonder, how can we treat it? Is it chronic, or can it heal and go away? Yes, if treated well, ulcers can go away. They can go away and you heal. How do we treat them? We have both home remedies and medical treatment where we use drugs. What home remedies can we use in this case for ulcers? One of them is for you to avoid as much as possible all the fruits that contain acids, the carbonated sodas, carbonated drinks, pineapples, and all other foods that worsen this condition. 2, you have to make your body alkaline. How? By including lemon in your diet. Lemon or lime. Lemon and lime. This one will increase alkalinity of your blood and your stomach, minimizing this disease. You can put lemon juice, you can put lemon in tea, you can just take lemon juice. Another one is using honey, pure honey. Yeah, you take honey in warm water in the morning on an empty stomach, and in the evening. It can also help you to reduce the incidence and the severity of this condition. We are going to the parts of the drugs now. What drugs do we use to treat this disease? Before we talk of the drugs, you should always take these medicines from a prescription which is written by a doctor. Not you yourself going to the pharmacy and buy these drugs, because you can easily have overdose, or you can easily take underdose and many other complications related to drugs. So go to your doctor and they prescribe for you these drugs, because most of the drugs we prescribe according to the signs and symptoms. We treat according to the signs and symptoms, then other related issues. So first of all, first choice, the drugs of first choice we use in this case antacids. We use antacids, commonly used. We have omeprazole, we have esomeprazole, we have lansoprazole. Those antacids, and you can use them for 12 weeks if you want, but the minimum is 8 weeks. That's like 2 months. The minimum is 2 months when you are on these drugs, so they help to bring back your cells to normal. Secondly, due to effects and acid very easy to histamine, we can always use what we call H2 receptor blockers. These include cimetidine. Cimetidine is an antihistamine and it is an H2 receptor blocker. It can also help you to relieve. Then in the case of Helicobacter pylori, we normally use metronidazole. We include metronidazole or tinidazole in your combination of drugs. Normally we give these drugs in a combination. We can give you antihistamine, we add an antacid, we add the antibiotic, we add like that. We give in a combination. And Verosa syrup can also help you to relieve these diseases and eating in time.